we can go ahead and get started. Good afternoon, everybody. My name is Norma Juarez, and I work in the Alumni Relations Office at UNC. Thank you so much for joining us today for the Alumni Career Panel, Careers in Nursing and Healthcare. As a current public health graduate student, I can say that I'm most excited to hear from our alumni today. We are honored to be hosting such amazing alumni this afternoon. A couple of housekeeping items before we begin. This event is being recorded and will be available on demand after the event. And I will share the website in the chat feature. I will also be sharing contact information from our panelists in case you want to reach out to them and address any questions that you may have after the event. And once we are done with panelist introductions, I will go off screen and return shortly before we wrap up the event to say a closing remark. Now, please help me welcome our panelists. And panelists, if I can please have you introduce yourself, stating your name, your title, company, your UNC degree, and telling us a little bit about yourself. And Jumer, we can go ahead and start with you.
Sure. Hi, my name is Jumer Sapinoro. I am a UNC graduate, 2013 from the School of Nursing, which was my bachelor's degree. I currently work for UC Health Medical Center in the Rockies, where I am the nurse manager on the cardiac unit, the clinical decision unit, and the discharge hospitality suite. I've been here since basically 2013. So I started off as a new grad in the float pool. So I went between both hospitals. And when I wanted to pick a home, I picked a cardiac unit here, and I kind of worked my way up as a charge nurse and now currently the nurse manager. I'm originally from Hawaii, and I, love Colorado, and that's why I stayed. So that's me.
Thank you, Jumer.
You're welcome.
Kathy?
Hi, I'm Kathy Hopkins. I graduated from UNC with my Master's of Science in Nursing in 2005. I am now a clinical nurse specialist, and I work at Cheyenne Regional Medical Center in Cheyenne, Wyoming. Although I live in Fort Collins, and I do the commute, which works out pretty well. I have the option, if it's a bad weather day, I can work from home if I need to. So that works out pretty well. I actually remember Jumer when he started at MCR, and always enjoyed him. I can totally see him as a manager now. That's exactly what he was meant to do. Perfect.
Thank you, Kathy. And now I am going to hand it over to Lindsay, who will be our moderator this afternoon. Lindsay?
Thank you, Norma. Welcome everyone who is watching live with us and those who may watch it on demand. My name is Lindsay Crum, and I'm a class of 2005 graduate, like Jumer, from the beautiful state of Hawaii. I came to UNC from Hawaii, and I serve as UNC's alumni director. I'm actually subbing in today because our original moderator, Grace Franklin, graduate of the Colorado School of Public Health in UNC's campus. She is a public health director, and as you can imagine, incredibly busy right now as our state and states around the country are dealing with the COVID-19 pandemic. And we'll touch a little bit about that pandemic and how it has impacted the career and work of our alumni here today. So with that, I just want to kick it off, start some questions with Kathy and Jumer, but I also want to encourage anyone who's watching to please use the Q&A feature of the Zoom webinar. If you'd like to pose any questions to Jumer or Kathy, when I think about having a conversation with two alumni like those with me today, it's such a treat because it allows us to get the insight into what it's like to really be a professional after getting your UNC education. So I just want to start with asking both of you, share a little bit about how your UNC experience in education has led to the career that you are in today. What does that path look like for you?
What did the path look like? I was a nurse. I had my bachelor's degree, and I was introduced to other nurses who were clinical nurse specialists, which meant they had, at that time, they had their master's degree. At this point, to be a clinical nurse specialist, you need to have a master's or a doctorate. At that time, it was a master's. And I was just so intrigued with their knowledge and their abilities, and I wanted that. So that's how I came to look for that path, and then found UNC, which Oh my gosh, it was a great program. I was so happy with that program. I felt like we were treated as persons who had lives and needs, and that was totally taken into consideration with our program. And I really, really appreciated that.
I love that. Thank you, Kathy. And I love hearing that you felt your experience was a positive one and that you were treated with respect as an emerging professional. Jumer, also having gone through UNC's nursing program, what are your perspectives on the role that it had in launching your career?
You know, the nursing program had a huge impact on my career, I would say. And, you know, it taught me a lot of things. You know, working as a team was one of the big things it taught me, because, you know, we're in a cohort and, you know, that's your class for the next, you know, 5 semesters or 4 semesters, whatever it was. Going through clinicals, doing group work, you know, just having the whole social aspect, you know, so working as a team, that taught me to do that. And with the social aspect, you know, there's a lot of communication. And that's another thing that's important in nursing, is communication. Again, you're working as a team, you know, you need communication to be successful, you know, to do in your assignments. UNC taught me how to communicate effectively and positively too, because, you know, you have to have that positive communication, especially in healthcare, where you have to work with a lot of different disciplines, a lot of different people. And then, you know, just having those strong instructors at UNC for the School of Nursing in the classroom and clinical, you know, they laid the foundation for me. And then clinical wise, you know, I could translate what I learned in class to the clinic. And so with all those things, you know, being a leader in nursing, you know, working as a team in communication, you know, I felt that UNC gave me that foundation, and, you know, I had a very positive experience at UNC, which is why you know, I love helping UNC out and doing these things, and just, you know, supporting the alumni.
Oh, I love hearing that. And I love that you mentioned teamwork. I know that teamwork is often discussed in the health professions and how important it is. If you were to sit down with a current UNC nursing student and talk to that student about how to approach their clinical work and their coursework so that they could develop those soft skills like teamwork and collaboration, what advice might both of you give those students?
I think I would encourage them to reach out to the persons that they see when they're doing their clinicals. Have those conversations with maybe their preceptors or the other nurses that are working on that unit. Ask them what they need, what they've learned, what can they teach you? You know, that just really helps make that connection. And as well as searching out what resources might be available in the community, I think that can be huge to learn about this service that maybe is going to help my patient down the road, or something else that will help them down the road. It just really rounds out who you are as a nurse and what you can offer your patients.
I love that. I love that so much. Thank you. Jumer, what about you? What do you think about that?
You know, I would totally agree. Like, as a nursing student, you know, you're on the floor. I remember when I was you know, second semester nursing student in med surg, you know, you're just like deer in headlights, and you know, you're basically you're following your precept around. And but going back now, I think about it, I was like, I should have asked more questions, like, hey, how does, you know, like respiratory therapy, you know, collaborate with you, and how does that collaboration work? Or, you know, how do you collaborate with different departments, and, you know, how do you communicate? And so, you know, just knowing what I know now, I would have probably asked those questions, instead of just, you know, we focus on the clinical aspect, but there's a communication, a team aspect, and a relationship aspect in healthcare also. And I think I would have maybe focused on that a little bit more, going through nursing school.
I think that's wonderful. Maybe reflect back on that first role you had after getting your nursing degree. How would you maybe take that experience that you just shared with us and translate that back into some advice for the you who was just starting out?
You know, I would say, you know, like the first thing I would say to any new grad, if yes, and even myself, talking to myself, I would say, no, you got to give yourself grace, because you're going into this and you don't know everything, and you won't know everything right away. And so you have to not feel discouraged that you don't know the answers to the questions. You just got to know what your resources are and where to find those answers, as well as, you know, don't be afraid to ask questions. because, use the questions as like an opportunity of growth and to help you grow, help you build that knowledge base up. So, just be patient and learn from every single experience that you have.
I love that. And that's a perfect reminder for anyone watching. Please use the Q&A feature if you have any questions that you want to directly pose to Jumer or Kathy. So Kathy, turning back to that question, what would be that bit of advice you would give that first year you just starting out in your nursing career?
Believe in yourself. And I totally agree with Jumer. That feeling that you don't know the answers is so awkward. Is so uncomfortable. There's actually a syndrome that people sometimes go through. It's called the imposter syndrome, where you don't believe yourself, you don't believe that you can do this. And so just being aware that that's kind of natural can help persons get through it.
Oh, I love that, Kathy. And I've heard of the imposter syndrome. We do sometimes talk with our students of all professional interests, so not just in nursing and healthcare, about that reality that when you graduate, you begin your career, you may sometimes feel that. What strategies have worked for both of you to overcome that and to give yourself the grace and the space to be confident and willing to put yourself out of the comfort zone so that you can grow and succeed?
I guess you just can't be afraid to experience what's out there and just take that leap of, getting out of your comfort zone. I think, that's a big part of growing personally and professionally, just stepping out of your comfort zone. And then like knowing who to talk to. Like, when I was a new grad, my preceptor was also my mentor. And so I always knew I had someone I could reach out to, even though they weren't next to me. I could, shoot them an email or a text message, say, hey, what do you think about this? Or what do you think about that? Or, what should I do here? And they would give me advice, and, I'd take that advice and stick it, in the back of my brain somewhere. So the next time it happened again, I knew like, okay, this is what I did the last time. This is what I should do this time. So, just learning from your experiences.
Thank you. How about you, Kathy?
I think use your resources, asking questions, getting that information, looking it up. I can remember when I was new to the emergency department. I wasn't a new nurse, but I was new to the emergency department, and I didn't know their processes. I didn't know what they did. And I followed another nurse when we had to respond to a code situation. And after that, I just said, what do you do? How do you know what to do? What's your process? And she walked me through it. She gave me the steps and boom, okay, then I have a way to respond now. I know what to do. And so that's just helpful to put it in the back of your brain and use it when you need it. It's great.
I think that's wonderful. I think both of you articulating that, being open to asking for help. So whether it's from your preceptor, from your clinical rotations, who may also be your mentor or a colleague, they're there to help you. When I think about professionals that I've worked with in different areas, I've never found somebody who didn't want to be helpful. I've always been so grateful for the relationships that I've made in the workplace. And really those individuals form my network. And so that may be not a term that everyone uses, but what both of you are describing, I would say, are part of your network. And we encourage our students to build their network, starting with the faculty at UNC and their clinical preceptors. What is some other advice based on your experience that you could offer students to help them build and strengthen their network as they enter the nursing profession?
Like my first network entering the nursing profession was basically my new grad cohort. Us as new grads, there's 15 or 16 of us, and we're still connected and we see each other around all the time. But those are my first like network, like right there, my new grad cohort. And then as I went through orientation, I had different preceptors that added on to my network. And then now I think the main way at UC Health that I build my network is I get involved. I'm engaged, I'm involved in different projects, different committees, where you can meet new people and get different perspectives of doing things and leverage ideas. So that's where a lot of my network is built, is through my committees and being involved within the system, not only in Northern Colorado, but in Central and South, our Central and South markets also. And then, we attend conferences as nurse leaders. I just make sure I always bring my card and I always hand it out and get contact info from people just so I can, leverage their ideas too. So.
Thank you. Kathy?
I maintained contact with a few of the faculty at UNC, which was really helpful for years. Just to see those persons and be able to bounce ideas off them or ask for help with something. And also, as far as networking, I joined my professional organization, several of them actually, and I am involved in that, which is a great resource because then you really get good information from somebody else in that role who can give you ideas for A, B, and C that I never even thought of. Okay, this is great. I'll use that. So it's been good networking to join those groups.
How has networking with whether it's former classmates in your cohort, faculty at UNC, or the professional associations, how has networking changed given the closures from the COVID-19 pandemic? Has your communication with individuals in your network, does it look different? Are you able to adapt that well?
I think the main difference right now is we do everything virtually, and so we're not meeting face to face where we don't have that the human interaction of somebody right in front of you, and it's more of the virtual world. And so I think that's the biggest change for me in terms of networking, because we still meet, we still have our Microsoft Teams meetings, and you see a lot of people on there, and but a lot of times you just you miss that human interaction aspect. I think sometimes the collaboration is better when you're face to face as opposed to on a virtual level.
I agree. As a job that involves a lot of people, I totally agree. And it's finding that way to stay connected and finding the way to have that human contact, even when we can't be physically in the same space.
Right, most definitely.
Yes, as we're socially distancing, we're also socially isolating. And that's difficult. That
is difficult. And I wonder for some of our students that are getting ready to graduate, they're looking at beginning their careers in such an odd time and way, whether it's searching for a job or completing their rotations and having conversations with hospitals and health centers. How can they be best prepared to identify those opportunities, those career opportunities after college, and be positioned to succeed, given how different things are right now?
I think it is really a difficult time. It's probably not going to be difficult to get a job. There's a severe shortage. Nurses are needed. So it's going to be that self-care once you're there. And I just encourage persons to take a little time for themselves, take that lunch, take that break, go to the bathroom, do those things you need to do for yourself, so you can have some time to center. And as we've said earlier, don't be afraid to ask questions. It feels awkward, but we would much rather respect someone who can ask us about something they don't understand or don't know how to do, rather than just moving forward and trying something that they don't understand and perhaps having some bad results.
I appreciate that. Thank you. Jumer, you were laughing as Kathy was talking about self-care. I wonder, is that a little reminder for you to maybe take those breaks?
Taking breaks and, using the restroom when you have to, that's hard to do when you're on a busy floor. And so I was kind of laughing because I always tell my team, like, you guys got to take breaks. You have to use the bathroom. And they say, I can't do it right now because I have to do this. I have to do that. So what I tell them is it's going to be there for you in 30 minutes, or it's going to be there for you in 2 or 3 minutes after you're done using the restroom. Like, you have to take care of yourself, because if you can't take care of yourself, who's going to take care of our patients? Like, you have to do it. And so that's a big thing we're doing, that the whole self-care portion, and one new thing I've trying to implement now in this time, with their COVID surge and, our staffing issues and everything is, like it's called three good things, like what three good things happened to you today? And everybody has to like name off three good things. It can be, I had a lunch break today, or, I went to lunch on time, or, I got a coffee drink and I really enjoyed it. It could be the littlest thing, but three good things, and that's part of self-care, just to kind of flip the mentality of like being busy and being shorthanded, and trying to make it more positive and trying to spin it a little bit so to a more positive aspect. That's one thing, I know like my team is trying to focus on, like trying to see the positive in what's going on and not being so negative all the time. And that's sometimes hard when like Kathy was saying, like you're not getting your lunch break, or you can't use the bathroom. It can be frustrating, but it's just the whole like self-care. Like we have to try and do it for ourselves, so we can be there for our patients and for our team and our peers here at the hospital.
Thank you. I so appreciate that. That's a great perspective. Three good things. That is something I will think of now. And I think it's also something as a good reminder for our students. It's an interesting time to be a college student and certainly a nursing student. And it's sometimes easy to get overwhelmed and to take a pessimistic look. So it's helpful. Thank you, Jumer, for putting that perspective.
And, speaking of nursing students, they are so thankful that they can come back into our facilities right now. And, they always express how, the gratitude of being able to complete their clinicals here in person, as opposed to virtually. And so, they're always thanking me, and, I always check in and make sure they're doing okay and everything. But so I got to support the UNC students.
Thank you. I appreciate that. We have a question from one of our listeners, so I'm going to go ahead and pose that. What do you do to ensure the hospital culture and supervisors care about our wellness and understanding when we're interviewing for these potential roles?
That's a good question. Culture, to me, culture is the most important thing when I'm doing interviews and hiring. We can always, for the most part, we can teach you skills, but, I want to hire for that culture and make sure, that we can keep our positive culture, and within that culture, is the self-care portion too, because we want to make sure everybody's taking care of themselves. We want to check in on people, check in on our staff. One thing I do is I'm personally invested in each member of my team. I know them personally. I talk to them on a personal level, not just work related level. It's because I feel like if I have that personal connection, I can build that trust and build that relationship where we can trust each other as a team, and we have each other's backs, and we can count on each other to be there if we need help. So just like I said, I try to hire for the culture, because we can teach the skills, but culture is sometimes hard to teach, and so that's what I look for.
Thank you. Kathy, any thoughts on that?
One of the things we do is during interviews, we have group interviews where they'll have several persons from the unit who are actually participating in the interview with that applicant. And that will give you some ideas of if that person is going to fit into your culture, and it also gives the applicant some ideas. Is this what I want? Is this where I want to be? So it can work both ways.
I appreciate that. I think that's a really good point, that as organizations are thinking about what talent they want to bring in, which professionals they want to bring in, they're thinking about that cultural fit. But we also want to encourage our students as they're applying for jobs to be aware of the culture that they may be walking into. So other than thinking about the interactions they have in the interview process, are there other ways that you would recommend students research or think about the culture of the organizations, the healthcare organizations that they may be joining?
That's a good question.
Yes, I think they should look at that, try to find as much information as they can about that facility, know their mission and their vision and their values. What do they say about themselves? What are they expecting? And come prepared with that. That can make a huge difference. That tells the interview team that this person is really interested. They know something about us. And so, that tells me that something about their work ethic and how they might fit.
I would totally agree with that. If if you did the research and homework on the facility you're interviewing with, if you know the mission and values, and that is impressive to me. That means you did your homework. Most definitely. And I tag along with that. For somebody applying at a facility or healthcare or wherever, one thing I like is when an applicant asks me, like, why do you like working here? That because that kind of puts me on the hot spot. They're interviewing me at that point, and I have to convince them that they want to work for me. And so that's when I brag about our culture, why I like working here, making connections with people. Everything good about UC Health, is what I'll tell them, because that's what I believe in. And my mission and our mission and values speak to me, as a nurse. And so I totally believe in that. And so I appreciate when I get those types of questions where I get to where they put me on the hot spot and I need to answer the question that I may have asked them a little bit ago.
Okay, so Jumer, putting you on the hot spot, what is the favorite thing about your work as a nurse, or maybe at UC Health?
Yeah. As a nurse, we get in nursing to help people out, to have interactions with people. And so when I was at the bedside, my favorite part of my morning was when I got to sit for a couple minutes with my patient, just ask them about their night, and how they sleep, or some personal questions. I'll ask them, well, what do you like to do when you're not here, or when you're out in the real world and not in the hospital, just making those personal connections. As a manager, that gets harder and harder because I'm farther from the bedside. But at UC Health, we do what we call leader rounds, and so I round every day on almost every single patient, just so I can have that personal connection with each patient, even though I'm not their primary nurse anymore. And so that is my favorite part of my job. That is like the favorite part of my day, is when I get to round on my patients and make those connections.
Wonderful, thank you. How about you, Kathy?
My favorite part is the people that work here care so much about getting the right thing done for the patients. It's just uppermost in their minds and in their activities every moment. And I love that. It just makes me feel so proud.
I love that. And I have to say thank you both, because you're being so positive. I think that it can be, I can only imagine what it's like to be a nurse or healthcare professional right now. And both of you are just exuding positivity and passion for your work. And I bet that that's inspiring to our students as they're getting ready to follow in a similar path, or maybe forge their own path. And I think that might be a great transition to talk about how that path might be changing given the impact of the COVID-19 pandemic. Certainly don't want to speculate, but what trends are you seeing or are you observing in the profession overall coming out of this pandemic or going through this pandemic that would help students have a greater insight about the profession they're about to enter?
I think one thing that is very important, like in this time with the pandemic and everything going on, is things change like every day or every hour. Every day there's a different thing or there's a different policy. So just making sure that your leader is communicating to you, or you're being communicated to, or you feel like you're being communicated to enough that what the correct thing to do is when you're here. And so like as a leader here, like I try and send communication every single day, even if it's the same, just to reiterate, or if there's slight differences, just to say, okay, this changed now, guys, so they feel like when they get here, they have all the information they need to do their job. And so I think just the communication portion and making sure you're keeping everybody up to date on what's going on or what's current is super important, just so they don't have to worry about that. They already know, instead of coming in and saying, hey, I didn't know that changed. That makes me feel, unimportant because you didn't tell me, just so they know they're still important, then I can communicate to them.
Thank you. Kathy, your thoughts?
Oh, that is such a good point, and it's so true. It changes by the minute, which is very, very difficult. You feel like you're just trying to walk on water. So I guess the advice for that student or that new nurse would be flexibility and maintain that communication with your manager, your director, whoever you report to try to get so you can get that information as frequently as possible. And believe me, all managers, directors, they all want to give it. They all want to put it out. They want people to be knowledgeable and aware. And there are just times when it changes with the wind and they may not know, it may not be out yet. And that's another awkward place to be because you don't have an answer.
Mhm.
But it's good to know that people ask and are interested and involved and want to know. Those are good things, I think.
Kathy, given some of the ambiguity that our new nurses might be facing, what are some strategies that you would recommend, or Jumer, that you would recommend to help them work through that? How can they find comfort in the discomfort, or still find a way to be successful given the lack of clarity and change that continues to happen?
I think it's kind of a summary of all the things we've talked about. Doing the self-care, keeping connected with your manager, being flexible and open to change.
Thank you. Jumer?
Yeah, like everything Kathy said, and flexibility is huge, especially right now. Being flexible with staffing, or you might be scheduled here, but you might be floated to a different unit because that's the unit that needs help right now. And so just being that flexibility aspect is very important. And then self-care, again, I would touch on self-care again, and just making sure you're taking care of yourself, or you have an outlet outside of work where you like working out or hiking, or doing something where you're making yourself better, and not you're not having to worry about work, just having that outlet. I would definitely recommend having something out there for you besides work where you can concentrate on something else.
I appreciate that. Maybe drilling a little bit deeper. Let's say that one of our new nurses takes a clinical job in a different state, maybe doesn't have some of the connections or networks that can provide that outlet. What's some recommendations that you would have for that new nurse in acclimatizing and getting settled so that they can both be successful in their role professionally, but also how to find those outlets and how to find those ways, and maybe you don't know where to start?
Right. So like if you're moving to a different, that's the hard part. If you're moving to a different state, you don't know anybody. Like you don't know anybody, you don't know what's around you, so you feel kind of isolated. With that nurse, I would recommend like maybe, getting involved in even your unit-based practice council, that you can meet your peers and get to know them on a different level, not just on the floor running around, but actually, sitting down and getting to talk to people, getting to know, like I said, getting to know your peers, and you can ask questions like, hey, what do you do when you're not here? Or what do you guys like to do? Or what's fun to do around here? And that way you can just, start socializing, making those connections on a more personal level and not only professional level.
Thank you. Kathy?
So I actually did that after my bachelor's degree, I graduated to that. I moved to another state and didn't know anyone. Well, I didn't know anyone professionally. I had friends there. And so it was a matter of reaching out and connecting with persons that I worked with, as well as maintaining some contact with my cohort of other students, as well as some former faculty, just to kind of get you that support again. So I would have that self-awareness that, yep, I'm okay, I can do this. It's all right. I'll follow their advice. It was helpful.
Awesome. Thank you, Kathy. We have another question from a listener, so I'll go ahead and read that for both of you. Can you please give information on nursing careers in case management, addiction, and some of the specialties that are not as focused on traditional or acute nursing?
That's the wonderful thing about nursing is there's so many different avenues you can head into, or different specialties you can head into. You can be a clinical nurse specialist like Kathy. I recently just got my master's in healthcare informatics, so you can go that route. You can be an educator. You can work for professional development and our education department. You can specialize in cardiology and neurology or orthopedics. There's so many different routes you can go, so many different degrees you can do, so much different certifications you can have. And that's the beauty of nursing. It's just there's so many things like besides floor nursing that you can do. Yeah, so I don't know if that kind of answers the question, but I'm just saying like there's many avenues you can do in nursing.
Kathy, any perspective on that?
I don't have any personal information. I would just encourage them to reach out to someone in that role. Maybe while they're doing some clinicals, they can talk to somebody who's doing that role and get information from them.
Thinking about a prospective student that might be applying to UNC this fall and applying to be pre-nursing and really wants to be a nurse, but not quite sure about the different specialties or options. How might someone just getting ready to start their college career go about learning about the different specialties and all the options available in the nursing profession?
I think you get that during your clinicals. You learn about the, excuse me, you learn about the different roles that are available, and I guess I want to say you don't need to worry about it when you're first starting out, because you'll get that information and then you can make those connections with somebody else. That sounds interesting.
Thank you.
Right. And in my experience, I didn't realize how many different types of roles a nurse could be when I got into nursing school. I was focused on, hey, I want to work in a hospital, I want to get to the ICU, things like that is what I was focused on. And then, when you get to the floor your first year, you're like, oh my gosh, there's like so many different types of nurses, like, with my new degree, how I fell into that is, I got involved in a project, and, there were informatics nurses. Then I was like, what's an informatics nurse? Like, and that's a nurse who uses, who like basically melds technology and clinical knowledge to help, with workflows and everything. And so I was like, man, I love technology and I love nursing. This sounds like my jam right here. I'm up, sign me up. So, and so that's how I got in, that's how I kind of found out about that. It's just like Kathy said, like you'll learn about it as you go through, you learn about all the different roles as you go through your career.
I appreciate that. And both of you have mentioned graduate education in slightly different veins. There are a lot of graduate programs that touch on the different health specialties and health professionals. What are some strategies or tips as a nurse considers going back and getting an advanced degree, whether it's, a master's degree or maybe a doctoral degree afterwards? What are some of the things that someone ought to consider in making that choice?
Definitely like,
I actually,
oh, go ahead, Kathy. You're fine. Go ahead, Kathy.
oh, okay. I have people come to me and ask that question, and I typically turn it back on them and ask them what they want to do. Where do they see themselves, their skills used the best? And what intrigues them? Where is their interest? And then we can explore options for how they can work in that role, something that fits for them.
I would totally
Thank you for being a mentor. That is awesome.
I would totally agree with what Kathy said. Like, that's what I would ask. A lot of my nurses want to be nurse practitioners, and they say, well, should I be an advanced, acute care nurse practitioner or a family nurse practitioner? And that's why I say, like, what do you want to do? Like, where do you want to be in 5 years? Do you want to be in the hospital, or do you want to, have your own practice, or do you want to work in a clinic? Like, I'm putting the ball in your court. I'm probing you to see what you want to do. You already know the answer. I'm just helping you, verbalize what you want to do. And so, it's like Kathy said, just, ask the questions. What's your passion? Where do you want to be? Things like that.
I love that. And I think that that's a perfect transition to the last question that I wanted to chat with you both about. We have so many wonderful students at UNC who have bright futures ahead of them. And we love connecting them bear to bear with the advice of alumni, like the advice that you give. So what would be a final parting bit of advice that you'd provide to a current UNC student getting ready to launch into their career?
with especially with nursing students, as you come out of nursing school, you always focus on, a lot of these students focus on specialties. Like I want to be in the ED, or I want to be in the ICU. And I'd say if you don't get those new graduate positions, you have to be open. Don't be discouraged if you don't get your first pick. Just be persevere. And if you get a job in not in the ED, that's where you are. Work hard, do your job there, and then always know that down the road you can always go to the ED after, or the ICU. So don't be discouraged if you don't get what your first pick is or your first choice is. Just be open, be flexible. You'll get to where you need to be. Just work hard.
Thank you. Kathy?
I really agree with that. Often I see persons who are in school and think they want to go to one area, but perhaps start out in a different area and then fall in love, and that's their passion. So it can change. So I think flexibility, being open, having grace with yourself can be very helpful in that situation.
That is wonderful. And I know that I said that was the last question, but we did get another question from a listener. This one's just a very practical question. Do nursing professionals or others in healthcare actively use LinkedIn?
It's social media. There's so much different types of social media. And LinkedIn is one of them. It kind of falls behind some of the others, but I'm trying to use it more, because that is like my professional connections, is LinkedIn. So I'm trying to be more professionally connected. To answer your question, I am starting to use LinkedIn more.
I am aware of some persons that use it. I don't personally.
Are there any concerns that either of you have as healthcare practitioners with the use of social media like LinkedIn or others that you think about and where you choose to be socially or in the digital space?
I'm always, because
you do have to be very careful. Junior, you go this time.
No, I was gonna say, that's exactly what I was gonna say. I was gonna say, I'm always super careful of what I post. And I always tell my staff, be careful what you post. And if you're posting things at work, I would totally prefer you not to. We have policies that are in place, but just always be careful, because that's how people see you, and you have to be careful of how you're perceived. So I'll just, like what Kathy said, just be careful. I'm always super careful what I post.
I think that is sound
So
advice,
true.
regardless of the profession.
Yep.
I think being thoughtful and part of the career that you build is the reputation that you build with that career. And sometimes social media can be a reflection of that reputation. Sometimes it can also be a distraction. And I think that's one of the challenges that younger professionals, up and coming professionals are facing, that perhaps those who attended college and began their career 20 years ago maybe didn't have to think about in the same way, just because the prevalence of social media, it was in its infancy. And so they're starting to, they're digital natives. They started to learn how to use social media at a young age. And so it's so intuitive to them. And as they transition to the professional space, how can they stay true to themselves and their interests, and also be cognizant of other expectations that might be around them, or other standards that they might have to be aware of, given how each profession operates in a different way.
Yeah, most definitely. I always look at it as like, all these social media platforms is my social persona. That's how people see me. And I want to be, I want to be perceived in a good way. So I always, like I said, I'm just careful of what I place out there. Because once you hit send or post, it's out there.
Yes. Thank you. And for those who are listening live, in the chat feature, Norma did share information on Kathy and Jumar. So if you're on LinkedIn or you just want to reach out, there's some ways to connect with our alumni today. So I please encourage you to take a look at that chat and do reach out. We also have so many other alumni professionals who are nurses, other healthcare practitioners, but also other professions. Maybe you realize that you want to be in an adjacent profession to healthcare, but maybe not a direct practitioner. Consider working with the Center for Career Readiness. That's a great place to start as a student. The Alumni Association works closely with the Center for Career Readiness. And so we're happy to make introductions to other alumni professionals. So if you're not quite sure, but you have an idea, consider the resources that are available to you through UNC, through our programs, through the Career Center and the Alumni Association. There are lots of ways that we can help you explore and figure out kind of what you want to do after you graduate. Any final words before Norma comes back that you guys would like to share? Any final questions that our audience has? I'm going to give you like 10 seconds before Norma comes back on, and I'll make sure that we can close this out and stay on time. Welcome back, Norma.
Thank you. Thank you to our panelists, Jumer, Kathy, for being with us today and sharing such great insight and advice for our students. Once upon a time, I was a pre-nursing student, and I would have loved to attend and hear from people and alumni such as yourself. It was an honor to host you today. To everyone watching, thank you for joining us. And I look forward to having you join us for our future panel next week. You can find information on our website at www.unco.edu/alumni/careers. See you soon, and go Bears.
Go Bears.
Bears.
Thank you.
Bye.
Thank you so much.